So it's 5 after, so I'm going to go ahead and get started. This introduction piece, many of you who have participated with us before have heard. So hopefully the people that are late have joined us before and already heard this part of it. Notice that today we're going over the ScHARe Repository. As you know, we have been promising this for over a year now. And the reason this is so important is because every NIH grantee is mandated by the NIH data management and sharing policy to post their data into a repository for public information. The ScHARe Repository is being built for that purpose, especially for minority health and health disparities research, healthcare research, health outcomes research, and any other kind of population science research that especially focuses on the social determinants of health. As we have promised, this repository will also feature many of the common data elements that we've presented before. And so today we're going to walk you through how to use the repository and what to do when you want to upload data. As always, this recording will be put on our Think-a-Thon webpage, and I'm sure BioTeam will put it in the chat, the link. And I'm not BioTeam, ScHARe will put it in the chat, so you know where to go to find all of our past Think-a-Thons, including this one. And it will be available probably in 2 weeks. Next, Kevin or Carl. So today I always like to do a background of ScHARe because not everybody has always, this sometimes is their first event. So it's important to understand what ScHARe is, and then we're going to go into the repository and how to use that. And when we do that, then Carl Gutwin from BioTeam, who is the developer and mastermind behind this, so he will take over and try and explain to you how to use the system. Next. As always, we like to do these polls because it helps us keep consistent data. And remember, we also do one at the end, which is like an evaluation. So I'm going to turn this over to Kevin with ScHARe, and he's going to teach you how to upload the Slido and then fill out the polls. Kevin?
Great. So as Dr. Duran mentioned, we'll be using Slido throughout today's webinar to get some feedback from you participants. To use Slido, you can either download the Slido app on your phone or simply go to slido.com on either your phone or computer. Alternatively, you can also scan the QR code that you see here on the screen via your mobile device, and that will bring up today's Slido. Lastly, my colleague Elizabeth will also be putting the link, the direct link for today's Slido in the chat now. So some people find that that is the easiest way to access Slido. And so to do so via slido.com or the app, you just need to enter code ScHARE, just like you see here on the screen when you get prompted. For those of you on slido.com, that will be at the top of the page in a blue box, just like the one you see here on the slide. And so let's actually just move right into our first poll here. I will bring that up. We'll go ahead and launch the experience poll. Again, feel free to use that link that's in the chat. You can use the QR code you see on the screen here, or go to slido.com or the Slido app and use that code ScHARE. So a lot of different ways to access the Slido poll, and we encourage everyone to do so right now.
And we really ask people to do this because it does help us tailor, and especially today, as Carl can see what kind of experience you have. he can also start to tailor his presentation to the experience level. So it's why it's really important that you do this for us, and because then it helps us help you.
We'll go ahead and take a look at some of these results now.
So as you can see, Carl, not a lot of proficiency in Python, so we need to same thing with R. Notice the none in cloud computing. We have health disparity experts, but not cloud experts. So this helps us be able to know, because, it's just like any field. Cloud computing and data science is full of jargon. And so one of the things that we try to do when there's not a lot of experience is try to make sure we explain all the jargon in the field, because it's not that it's hard to understand. It's easy enough to understand. We just have to not use the jargon world. Okay. So I think
our second poll here, if you're ready, Dr. Duran.
I was going to say, let's go to the second one.
And so you'll pull up this poll just in the way you pulled up the first one. And actually, if you're on the screen, it should have pulled up for you automatically. So please just go here and reply to this poll we have up. As it says up top, you can select multiple responses.
And for those of you who are clicking in, because I see some increases, just look in the chat and it gives you the links to how to get to the Slido and those kinds of things. So just look at your chat. And while you guys are filling that out, I'm going to go through the next section fairly fast, because I really want the time for Carl to help you learn how to use the registry. We really encourage our grantees, especially doing health disparities researchers, to use this particular registry, because what we're trying to do is fill this gap at NIH, where most of the repositories, if any of you guys have tried to use them, are more basic science, and they don't have a lot of the population or social sciences. There's only one repository that actually has some social science, and that's the general repository. But if any of you guys have ever used that, it's just kind of a deposit your grant data, and it's kind of, I don't want to publicly bash anybody, but it's a little chaotic if you try to use it. So hopefully we'll try to get more of the population science, health disparity sciences into this repository. And because we are using and really advocating for the use of common data elements, this is one of the most important concepts I hope you take home from today. We don't live in a world of silo data anymore. All of our data is, we have to start thinking of it as, how is someone else going to aggregate with our data in order to create big data that AI can use. If we can stop thinking about that silo approach of, oh, I have to protect my data, I only can do my data, then we can start creating a better interchange, a better exchange of data. And that's the whole goal of the ScHARe platform and this repository. In fact, Carl's also going to explain to you one of the tools that they developed was a data aggregation tool so that you can put data sets together easier. In order for us to achieve that, and this is each of us, right? Every single PI that creates data, whether it is firsthand data collection or epidemiological data. If we use common data elements, it helps us to create data harmonization and data interoperability between data sets. You're going to do this either retrospectively or prospectively. It's your choice. And so what I mean by this into prospectively, it's using the common data elements, because then we can do it quicker and faster. If you do it at the end, you spend, it's called data cleaning, data wrangling. You'll spend hours. 80% of your budget goes to data cleaning. But if we can do this prospectively, we're in a much better position. So that's the whole purpose of using common data elements. And we're going to go through some of this stuff in the presentation today. If we go too fast or you have questions, please put it in the chat. Elif and Luca are part of the ScHARe team, and they will answer questions as much as we can right through the chat. We don't do a lot of questions and answers until we're towards the end, but this is very important, and I want to be sure that you understand the concepts of all of this. So please use the chat. And if it's something is really relevant, and I think that it's probably something that many of you are confused about, I will stop the conversation and ask Carl to re-explain and to help us get this in a little bit better. Also, if you have technical kinds of questions of what's CITEM, we'll help you there. All right, so let's start, Carl. So what is ScHARe? Notice that there's one little change from those of you guys who've been here before. Notice that we have a fifth bullet. So it used to say 4 critical gaps, but now it says 5 because the fifth bullet is now the data repository. So remember, ScHARe was created to increase the participation of women and underrepresented populations with disparities. It is really to help health disparities research create a paradigm shift from using single laptops to using big data in a cloud platform, because this is where the knowledge is more comprehensive and can be generated in a way that we've never been able to do on our laptops. And of course, we're always interested in bias mitigation and ethical inquiry, because most of the biases that occur are biases against vulnerable populations, which is who we represent. And to provide for you a data cloud resource that is easy to use and has easier functions so that it's accessible to everyone. Next. ScHARe is made up of Google is the platform, but it has a Terra interface. And for those of you who've never used Terra before, there are tutorials on the Think-a-Thon page on how to use Terra. And we will do some sessions at the beginning of the year in January on how to use Terra again, because we try to do this at least once a year to get you, the new people, a little more up to speed. The most important part that I can advocate for learning Terra is that if you learn Terra here, You can learn, you'll be able to use the other platforms at NIH, such as All of Us, Biodata Catalyst, and Anvil, because we all use the same interface. And we all use the same interface means you learn it one place, you can use it all these other places, and it will help you learn how to data share across these platforms. Next. The share components, we have data sets. This is what we've been using the first pretty much year of ScHARe. They've been federated data sets that are on the ScHARe platform. We've demoed these in many different ways, and there's over 260 data sets available to everyone. We are now getting ready to release the repository that we have been promised you that's coming. It has computational abilities and tools, analytic tools, and very soon SAS will be available as well as all the computational tools. We have a web page on the NIMHD web site. If you can put that in a link in the chat, please, to the web page, because this is where you can register for ScHARe, you can register for Think-a-Thons, and you can get on our news list. Next. So one of the things on Terra and why we chose Terra is because it does offer a secure workspace. And by secure workspace, it's almost like, for those of you who are not clear what it is, it's almost like having your own laptop on this cloud. In other words, it's a place that nobody can get into unless you give them permission. So you can have your own secure workspace. You can share it with other collaborators, and you get to control access of it. So the ScHARe workspace works on a cloud very similar to like hosting your own laptop. Next. Terra, we also have analytic tools. So see the little tab where it says analysis. In that, we have many code already written, instructions on how to do things. They're easy cut and paste analytics. What this allows us to do is to open up this platform for you and you don't have to know Python. You just need to read the code, plug in your variables, and then run analytics. And we build this more and more for you all as an easy way to use the cloud without learning Python. Of course, we're encouraging you to learn Python or R, but this is sort of the stepping stone to get you there. Okay, next. As I said, we have access to lots of data, and as you can see, there's a data tab, and the data is, there's over 260 data sets in there now, and it's this particular data is all federated data. And what I mean by that is it's public, accessible data, and the data sets we have in here really focus on the social determinants of health in a centralized location, which there is no other place for this. There is ARC has a data link page, but this actually gives you the data so that you can put it into your analysis. Next. These data sets, there's over 260 of them now. We have some that are public data sets, and then we will be adding funded data sets. So coming soon are things like the Jackson Heart Study. We can't really do this until the repository is built, and then we're going to house these kinds of data sets as well. Grant projects from the extramural and from intramural. Next. The data sets that are federated, that are on the ScHARe Terra workspace, are organized They're public available. They're organized by the common data, or I'm sorry, by the social determinants of health, by the CDC. So as you can see, it's economic stability, education, healthcare access, neighborhood built environment, social and community context. We've added 2 additional categories, health behaviors and some disease and conditions. Not a lot of disease and conditions, because you can link out to other websites like ScHARe for cancer data and bring it into this platform. So we don't want to replicate what other people are doing when you can share. And the reason health behaviors is separate is because health behaviors are not social determinants of health, but behavior is a very important part of any type of healthcare analysis. Next. These are the social determinants of health in case you don't know CDC categories. They're also, you can link to them when you see the slides. Next. And this is basically what they cover in the categories that I just talked about. Next. This is an example of some of the data sets that we have. American Community Survey, the census, different census data, area deprivation index. These are just examples. There's 200 more. Next. In order to get to, notice that you saw ScHARe hosted data sets and Google hosted data sets. Most of those that are in the Terra workspace are ScHARe hosted data sets. That doesn't mean anything really to you guys. It just means who pays for it. And it also means how do you get access? So to get access to the Google hosted data sets, you have to go through this big query. And this is the code, and it'll take you right to the Google hosted data sets, which is another whole bunch of data sets available. Next. If you want to see all the data sets that are there, all you have to do is scan. Next. So I'm going to move into common data elements because this is an important part of our repository. And remember what I said at the beginning, it's important because it allows us to create data sets that are more shareable, more aggregatable, more interoperable. Notice the ability. So the benefits is not only that they're shareable, but if you use common data elements, especially when you're talking about things that every study collects, like age or race and ethnicity, then why reinvent the wheel? Just use what's already there. And the ScHARe CCDEs have already been developed that cover some of the demographics as well as some of the social determinants of health that are most common. Next. These are the ones that we have included in the repository: age, birthplace, zip code, etc. The 2 pieces down here, the NIMHD framework and the health disparities outcomes, notice that it says these are project level data, common data elements. These are not, all the rest of these are individual or program related, but these 2 are project level. And when we get to this, as Carl is going to present, I will go back and explain these a little bit later because this is the first step in the repository. Next. And this is what we're going to be discussing today, the ScHARe Repository. When you create your data collection, your data sets uploaded, you will, it'll be a safe space. So it has privacy. You don't have to worry about people stealing your data. It complies with the data management and sharing. I said it focuses on the population social sciences types of data. You can link to biomedical data in all those other repositories like Anvil and Biodata Catalyst. And it's CDE centric, and it allows us to link your data with other data. Next. So the last thing I want to cover, and then it goes over to Carl to explain, is Think-a-Thons. So you're here at this Think-a-Thon, so you know what Think-a-Thons are. It's our monthly webinars that we conduct in order to teach you how to use many of these tools, how to upskill in data science. We've covered many of them, and next slide. They're really designed to have multi-career levels, from students to senior investigators, multidisciplinary, meaning from social scientists to basic scientists, clinical, everything in between. And we bring people together to have discipline exchange. Because what we've learned from this is that oftentimes we upskill the best by each other helping each other. And that's what the Think-a-Thons are designed to do. Next. We have two types of Think-a-Thons. We have the tutorial ones like today. Today is a tutorial Think-a-Thon because we're teaching you something about how to use something or how to do something. And the other types of Think-a-Thons that we're having are research Think-a-Thons. We're going to launch these maybe 3 times a year because these teams continue on, and we'll get an update of what our research Think-a-Thons have done early next year, because these have already been in process, and some of them are actually ready to publish. Next. This is some of the Think-a-Thons that we've already done. Notice that the bit link there, and I'll have Saidam put it in the chat for you, so you can quickly go there. These are not only videos, but PowerPoints, so that you can go back and learn. We also do special event Think-a-Thons. We've done one for educators, one for Native Americans, and one for coders and programmers. And I'm going to give a plug because next week, next Wednesday, we're going to do a special Think-a-Thon for community engagement in artificial intelligence. It's about demystifying AI for community members. We're going to have 2 sessions, one in October and another one in November. The one in October is called Demystifying. And Saidam or Luca, can you put the link in for them to register for Demystifying AI for community members? And the one in November is going to be about empowering community engagement in AI research projects. So I hope all of you on here will also participate in those and join, because this is an opportunity to help the community understand that they have a role in AI research. Next. And of course, our main focus, especially in these research and everything we do on ScHARe, is about transparency and fairness, because it's only through transparency do we actually mitigate biases and help to move AI forward in an ethical way that allows no harm to be done. Next. We also have partnered with Aim Ahead, which is another initiative, so that we can also help for those of you who are in the ScHARe Think-a-Thons to actually move you into Aim Ahead fellowships and other projects that they do, which then they are linking to other projects with Biodata Catalyst, N3C, Anvil Hill, and all of us. So we're trying to create an upskilling pipeline for all people who are underrepresented in data science to become represented. Next. So I'm going to turn it over to Carl now
Thank
for
you
the
very
repository.
much. Thank you very much.
So Carl, like I said, is the main developer of the repository from BioTeam, who is our contractor who built the repository.
Hi, folks. My name is Carl Goodwin. I am with BioTeam as a principal consultant. BioTeam is an organization dedicated to advancing science in technology. And so we're really grateful to be a part of this ScHARe team. We believe strongly in their mission, and we've had a great time building a new set of technology around data repository and data processing system. So thank you for your time today. I understand that this is a time investment for everybody. And as such, I hope that everybody has something to get out of this. In particular, we've designed this session to be interactive. We want you to be able to use the site and follow along with us as we show things. Of course, this is actually kind of our first tour around, especially with such a large group. So any grace you give us as we iron any kinks out would be much appreciated. But with that said, we'll get right into talking about the repository and why we built it and why we built it the way we did. So it's been said a couple of times, the ScHARe repository is data repositories specifically intended for hosting population science data. But unlike many other repositories, it integrates in tools that allow you to explore, manipulate, and aggregate data. So it's designed to be an integral part in the ScHARe ecosystem, and you'll see more as we go through the tutorial today how that all plays out. What can you do with the repository? As you might expect, you can put data in there and you can share it out to your community. But as was mentioned, the repository is CDE centric and is specifically designed not only to accept data that conforms to CDEs, but also give you the tools and abilities you need to be able to align data to those CDEs, even when that data may not have been collected exactly to those CDE specifications. It also has capabilities for building aggregates of data sets, as well as building extracts and subsets of those data sets. And as was mentioned, it really is a place for data sharing of all shapes and sizes, whether you are just sharing with yourself or sharing with a confidential set of colleagues or the broader world. We have all of those here. Many of these things have basically been said, so for the interest of time, I'm going to move past here. So we're going to jump right into getting started on the repository. This is the URL for the repository, but I will caution you today that sadly, due to some internal hangups, we weren't actually able to bring this particular site online today. So for the purposes of our tutorial, we're going to be using a parallel site that we've used for testing with our internal collaborator testing team. The site functionally is identical, but the key distinction is that the data that you upload to this test site will not be retained following the conclusion of this tutorial. So we encourage you to actually use it, play around with it, go off script if you feel confident to do so, but just recognize that anything you put there may not be kept for much longer past the end of our time today. And we'll make sure that this link is repeated in the chat, posted in the chat as necessary. By the way, the general format that we're going to have for this tutorial session is I'm going to present a sequence of slides that demonstrate a particular concept. These slides will be very heavily rich in screenshots, and I'll kind of walk you through it verbally. And then once we get to the end of that section, I'll break out of the slides and I'll pull up the actual site. So we'll do a demo. And it's at that point that I will encourage you to kind of click through and follow along. Although if you feel encouraged, you can do so as I talk. I would recommend that any questions that you have, you can post them in the chat. If a question comes up that is particularly significant, we'll pause the discussion and we'll address that question right away. But there will also be time for questions, hopefully at the end. When you visit the repository, at first, you can browse around completely without logging in. There's a bunch of information that's available just like that. But again, for the purposes of our demo, since we're going to be uploading data, you will need to log in. And logging into the repository is very straightforward. You click the sign in link that's up at the top, and then there will be a button that says login with NIH login, and you'll be taken to an NIH hosted page where you can conduct that login process. If you are an NIH staffer or NIH affiliate, you can use the upper segments of that screen to be able to use your NIH credentials. If you're affiliated with a university, or if you can use login.gov, which is a login site that US citizens have easy access to, we also recommend those methods. They're linked in smaller buttons near the bottom of the screen. If none of those options are sufficient, you may use login credentials from sites like Google or Microsoft, but be advised that you may not be able to get the full range of access, secure level of access that you would if you used credentials from your research organization or from NIH. Once you've completed the sign-in process, you'll be back at the repository and I'll present a page that asks you to confirm the terms of use of that site. We ask you to review those terms and then accept to move on to the site itself. Very quick tour around. There's a bar at the top where there's links to information. There's links to the data that's present on the site, as well as the CDEs that are present. There's, of course, a search bar and a box for you to control your login and your user information. And then over the left-hand side, there's a place for recently accessed data.
Carl, do you want them logging into the test site now?
If they can log in now, that's fine. They can also begin to log in when I jump into the interactive portion.
Okay, for those of you who are brave, you can try logging in now. That'll cut down on some of the effort when he does everyone to do it. Because, you know, then when 900 people do it at one time, it's a little slower. So if you're brave enough, you can try to log in now. If not, you can just wait.
Thank you. So as an example, if you click the CDEs link at the top of the page, you'll be presented with the CDEs that ScHARe has curated. In particular, I encourage you to visit this site when you're curious about the CDEs and when you would like to get more information about a particular CDE, because as they're listed here, you can click on an individual definition, expand it, and see all of the details. And we'll see what that looks like in the demo. Actually, that's a great time. This is the end of that section, and we'll begin the next section right after this. So I'm going to break out of the presentation and switch over to the site. So as you noticed in the URL, it's test-share.nimhd.nih.gov. When you visit there, it'll look like this, and you'll click sign in.
So you want everyone signing in now, Carl?
Please, thank you.
Okay, so follow the instructions. And Carl, I'm going to ask you to slow down so that they can click on it. It's going to take time for it to upload.
Of course. So once they get the site loaded, go ahead, click here on Login with NIH Login, and you'll get to this site. Now, again, as I said, if you have research organization credentials or NIH credentials, please use that. Unfortunately, as a commercial contractor, I'm not able to access either of those on this particular site. So I'm going to use my Google credentials, which will work for anybody else as sort of a fallback. I have noticed, by the way, that when I sign in through Google, it spins here for a little bit. this seems to be completely out of our control. It's something between the NIH login site and the Google identity provider, but it will eventually, after I ramble on for a few moments, it'll load up. And then it'll present me with a screen where I'm asked to just confirm that that I'm consenting to this login process, which is very straightforward. You just click grant. Different providers will have a different screen at that point. And then you'll log in. Most of you who are logging in for the first time will have at this point seen that splash screen that says, do I accept the terms of use? And you'll have to click through each of the tabs that are presented there and check the box. And then once that's done, click the accept button to join on the site. So as I mentioned before, there's some navigation links up here, about and documentation.
Okay, Carl,
skip
I'm gonna
over-
ask you to just wait a few minutes, just
Yep.
a second. Make sure people got logged in, because I don't want them missing this stuff while they're trying to log in.
Sure thing.
So we'll play elevator music.
If anybody's having problems logging in, as
Well,
opposed
that's Jeopardy
to
music.
if anybody's having problems logging in, as opposed to just simply it being slow or whatever, please post in the chat. If you are unable to log in with one of the provided methods, let us know. We can attempt to troubleshoot. I'm seeing a couple of messages.
Yeah, I was gonna say, do you see the chat?
Yeah.
Can Michelle or somebody go to Benin or Michelle go to a breakout room and help them? Do you have anybody?
Yeah, absolutely. Is there,
Kevin, will you create a breakout room? And if
Yeah, I'm going to create breakout rooms right now.
if you have trouble, what I want you to do is to raise your hand, and Kevin will look at the list and he'll automatically put you in a breakout room with Michelle, and she can help solve whatever problems you're having. Okay? So if you're having trouble logging in, just keep your hand raised. Kevin's going to put you in a breakout room with a bio team member who will help you log in. Okay? And while they're doing that, looks like some had some trouble and have made it through. And we really encourage, I really encourage all of you to try to log in and do this with us, because I know from taking classes like this and webinars like this, if I don't do it hands-on and I try to go back, I'm like, oh, I forgot. So please, this is really here to help you. Pat Sloan needs in a room. So please log in, and just so to make sure that you can do this, okay? Okay, so it looks like most of the people who are having trouble are in a room now, Carl, so why don't we move along?
Yep. Yep. And again, this is very basic stuff, so I think most people will catch up if they have to drop back to solve the login problems.
And again, if you're having trouble, just raise your hand and Kevin will put you in a room, in the breakout room, and a bio expert will help you.
Okay. let me just talk through this screen really quickly.
I'm sorry, Carl, I have one more thing.
Oh yeah,
Mohammed on my team, will you please go to the breakout room? Kevin, there's a few more with their hands up.
Yep. Getting everyone moved over now.
Okay, Carl, sorry, go on.
absolutely, no problem. So this is this page on the repository that lists the CDEs. This gives you a chance to explore the set of CDEs all in one place, and they're grouped together in categories. By clicking on any one of these CDEs, they'll expand and you'll get the full set of definitions, as well as permissible values. I mentioned permissible values in particular because some of the CDEs are actually very specific about the expected values or the values that the system expects for your data. And you'll actually see that come up a couple more times. But as I just scroll through here, you'll be able to see a little bit about where that is, where those are coming from. Okay. And then lastly, as I mentioned, there's a menu here where you can view your user information and sign out. And then there are some groups on the side here that give you quick access to some of the collections that you've been working with most recently. So with that, I'm actually going to jump back to the slides, and we'll start discussing what it means to actually begin uploading data. Okay. Yeah, so let's talk about collections. I see a couple of comments in the chat about collections, and in fact, you're correct. We'll get we'll get right started. Collections are essentially the site's name for the container that you put your data into, and as well as other people put their data into. They are a place where you can attach metadata to your data, as well as uploading any sorts of documentation relevant to your data. And they're also a place where you can organize your data into folder structures and add multiple files, etc. So if you think about this collection like a container, it's logical that the first thing that you need to do before you upload any data to the repository is to create a new collection that will host that data. So that creating collection process is very straightforward. On the collections page, there's a button in the upper right-hand corner that says Create New Collection. After you click on that button, you'll be presented with a screen where you'll provide some basic information about this new collection. We recommend that you provide a readable name that goes in that single line name of that collection, and then an abstract. So if you're working on a project or you have an abstract ready, you can cut and paste that, or you can write something up. All of these details can be updated later if needed as well. So for our demo, you'll be able to put some basic stuff in there and maybe go back and change it if you'd like. At the bottom half of the collection creation page, there's a place for you to fill in tags and project level CDEs. So the tags are a combination of pre-selected tags. When you click on the tag box, you'll get a drop-down list that you can select from, or you can type in your own tag values if that's valuable. Obviously, we recommend that you use the pre-selected ones that'll help for better data organization. The project level CDEs, though, those are selectable from the drop-downs that are provided.
Excuse me, Carl, let me just encourage the use of tags, because it is the tags that help us to make all of the data searchable. So as you go through your tags, if you want to go through the whole list that is in the dropdown, of course, and select as many as possible because it allows your data set to be searchable under that topic area that you tagged. If there's something on there that you think would be a tag and we don't have it on the list, please add it in. And of course, if many people start adding that in, then we'll make it a standardized tag. So this is a very important step because the goal of this repository is to be more searchable friendly and to be more aggregation friendly. Sorry, Carl, go on.
No, that's fine. As a matter of fact, this is now the point where you can break in and talk about the project level CDEs.
Okay, so Carl, can you go back to the slide?
Yes, of course.
Back one. Okay, so the reason that he flipped over is because one of the things you do when you first sign in to upload your data is you do the tags, and then you have to assign project level data. And so I want to explain to you what this is, because if you're an NIMHD researcher, you kind of know this now because it's something that we even put in most of our terms and conditions and grants. But if you're not, I want to explain so that everyone understands the value of this. Next slide. So NIMHD created a framework. This is what the CDE looks like, the question and the acceptable responses. So it's the levels of influence and the domains of influence. Next, Carl. This question was developed from this framework. So this framework it's been published. It's what NIMHD uses to guide much of what we do. So we took the levels of influence across the top, and that's the individual, interpersonal, community, societal, and the domains of influence, which is the behavior, etc. I love Citem. Elizabeth put the link in the email. In the chat room, so you can see it on the NIMHD webpage. Carl, can you go back now? Go back. So notice that from that chart, this is how it was created, these questions. Okay, next and next. So the other piece that we ask you to do is, what is your research area focus? So at NIMHD, our title is Minority Health and Health Disparities. Our goal is to improve minority health and to reduce health disparities. So in our definition, we ask, and you can select all that apply. So your project could do all of these things. But it's really, what is your main focus? Is it minority health, improving minority health, or is it reducing health disparities? Or is it some other healthcare outcomes or healthcare delivery? Because we also are in partnership with NINR, which is the National Institute of Nursing. So a lot of theirs focuses on healthcare and healthcare delivery. If you know the definition of minority health and health disparities on the NIH webpage, you will know that these outcomes, higher incidence, premature, excessive mortality, global burden of disease, poorer health behaviors, and worse outcomes are the areas of health disparities metrics. So we ask that whatever your study does, clicks on one of these or all that apply. This is a very important part because one of the things that we always have to do is we have to advocate for funding, right? And that funding comes from the federal, Congress, White House, etc. One of the ways that we can prove that is that we show that we're achieving our mission. When you click on these, the framework and these project levels, you help us get the data that we need to prove that we're achieving our mission. So please do so. Next. This is our mission. Minority health is to improve the health of racial and ethnic groups. Of course, the research then is to look at what are the causes of health outcomes. Actually, I'm sorry, this minority health slide is not up to date because this, there's a new category that was added, and that's the MENA. So we followed the new health disparity guidelines. Elizabeth, will you put the link in the chat for me so that everyone knows what the definitions are, please? Or the new categories. Next. In health disparity populations, we're looking really at differences that adversely affect a disadvantaged population. And in that disadvantaged population, it means that something could be mitigated. Like there isn't a reason that a health disparity exists. Sometimes there's a difference, and that difference can't be mitigated. But there are some differences that could be prevented and mitigated. That's a health disparity. We have different health disparity populations that are beyond minority health and beyond racial and ethnic groups. So the racial and ethnic groups are just one of the health disparity populations. There's also people with lower socioeconomic status, underserved rural communities, sexual and gender minorities, and people with disabilities. So those are all the health disparity populations. By the way, I know some of you are sitting going, but there are more populations with health disparities. Yes, there are. But these are mandated by legislation for us. And the last two, the sexual gender minority and people with disabilities, even though they're not in legislation, there's a caveat that says that the director of NIMHD and the director of ARC can designate a health disparity population when there is such a glaring disparity. And so the sexual gender minority and people with disabilities have been added, even though it's not legislatively mandated. Next. And of course, we're looking at the health outcomes. One of the things that we did years ago, and in the publication probably in 2008 or 9, we operationalized what a health disparity outcome is, because people were saying, oh, we have health disparities. But without a metric or an operationalization of that concept, we don't know that we've made improvement. So these 5 areas are the ones that we're looking at as health disparities. Next. Now we're going back to, and so I'm going to do my last little advocation, is that this helps us at a mission level, as well as it also helps us to, as a search tool, those that are also looking at things like premature mortality. So these tags and these caveats like this actually help us to create better data aggregation.
Thank you. Okay, so we're picking up this this narrative thread at the point where you've gone through that page where you've filled out the details for your new collection. Once you click that submit button at the bottom, it'll take you to the main page for that collection. And that page is the point where you can basically do everything you need to in the context of that collection. Browse and upload documentation, browse and upload data items. You can do actions on the collection, such as sharing it or editing that metadata or deleting the collection if you're if you find it no longer necessary. And there's a sidebar on the right that gives some key information. We'll talk about that key information as we get further on. One little tidbit that you might not pick up on is that up at the top of that screen, you'll see the name of your collection in blue. That is a link that will always take you back to this main page. So if you're navigating around and you get a little bit lost, you want to go back to where you want to get the main site, just click on that name. First, I'll show briefly how you add links and documents. So that links and documents section that I showed on that main page, you can expand that out by clicking on it, and there will be a little add new button there that'll bring up a dialog where you can either upload a document and provide a little bit of information about what that is, or you can toggle over to search for a publication that may already be on PubMed. Just put in your PubMed query and then find the publication in the list below. Or you can just add in your own hyperlink if you've got a link to a website or your group's page or whatever. In terms of uploading data itself, the process is very straightforward. There's a data items section there, and as you expand that out, there'll be a little drop point there where you can either drag and drop or click on it and pick a window to select a data to upload. You can upload any file you'd like to the ScHARe repository. So that includes documents, archives, etc. And some of those formats, for example, PDFs, they'll be previewable in the web interface. But if a document can't be previewed, you can offer it to people to download if they'd like. But the power of the ScHARe repository is primarily around its ability to handle tabular data. So that might be jargon, and so I'll make sure that that term is clear. Tabular data is any form of data that can be represented effectively as a two-dimensional grid of rows and columns. You might think about it like a spreadsheet. You might think about it as a data frame if you're coming from a more code-based background. And I'm sure lots of these statistical packages also have their own terms for these tables of data. When you upload data to the repository that's in a tabular format that the repository recognizes, it will be able to parse that data and offer a number of additional features that go beyond just its ability to handle raw files. Most of the rest of this tutorial will show what those features are, at least get into some of the aspects of them. Now, for the purposes of our tutorial today, we're going to recommend that everybody use the same example data file. That'll just make our use of the site a little bit more consistent. We might be able to answer questions that are more specific to things that might come up if you're playing around with that, versus if you're using your own data. But of course, as you're experimenting, feel free to try and use your own data and see how the site works with that as well. There's a link posted in the chat, which will take you to the collection that hosts this data file. Or you can navigate it. If you're logged into the site, you click on collections and scroll through that list and find the collection listed in the public collections section. It's usually at the way bottom of the screen. And then you'll see that collection. You'll jump into that collection's main page, and then you'll see the data items section. You click on the word data items, it'll expand down, and then you can click on the little 3 dots, and then there is a download link, and that will download this small CSV file to your computer. And once again, when we get to the interactive portion, I will show how that works. Some of the other things that you can do kind of while we're in that space, so you could click on the item's name and view the page that shows all the details about that item. There is a little status icon that sits to the left of the item's name. And that status icon will tell you what the repository thinks about your item status when it comes to storage, parsing, and validation. And we'll actually cover what all 3 of those things mean. But in general, for right now, all you really have to think about is a green and a check mark. Check mark is usually a good thing. And then again, there's this status bar on the left that shows you, that confirms that your data is private. So when you initially create a collection, that collection is private to you. And we'll talk more about access levels when we get to that part of the tutorial. And it'll also show you a little bit about your CDE compliance. And that is also something we'll get into a little bit more later.
Excuse me, Carl,
Mhm.
I want to interrupt just one moment. Michelle Bailey, I need you to pay attention to the chat and to respond to technical questions that are being asked in the repository. There's a error message that came up like 431 ops something. So
Yeah, Dr. Duran, Michelle's in the breakout, I think, troubleshooting folks.
oh,
I don't
okay.
know if she's logged in twice, but she's currently in the troubleshooting
Oh, she's
breakout.
still, okay. So then, is there someone else, Carl, that can answer some of these chat questions? Menon, no, is Menon on here?
I don't think, probably not.
Okay.
Otherwise, I can send people to the breakout. Again, if you raise your hand, if you're having a troubleshooting issue that needs to be addressed, raise your hand, and then I can send you to the breakout to get some assistance.
Okay.
Okay. Thank you. Just making sure. By the way, there was a question posted in the chat about which data set. So it's the one that's listed as ScHARe Think-a-Thon example data. When you click on one of the data items, you'll be taken to a page that shows you the tabular data information. And as well, there's a number of tabs up at the top of that screen where you can view other things like the item's data dictionary, metadata about that item, etc. And then in particular, I want to draw your attention to this little information icon next to column headers. So column headers that have this little information icon are those that have been annotated with a given CDE. So when you click on one of those little information icons, a pop-up will appear and it'll give you information about that CDE, the details in terms of the concept coding and the definitions, etc. So that's also kind of a quick reference to the columns in a data file that have been annotated with CDE references. So this is the end of another section. As I said before, I'm going to jump over to the live demo portion and we'll see what this looks like. So I'm going to, again, go back in our narrative to that process of creating the collection. So if you weren't following along as I was going through this on the slides, please follow along with me now to create a new collection. Click on this link up at the top that says collections and then click create new collection. And you'll be taken to this page where we're going to fill in a collection name. And so I'll just say today. And I'll put in a brief abstract. And then I will select from the tags. My screen unfortunately puts the drop down in a very funny place, but I've never seen this happen for anybody else, so I don't think it's a big problem. And then I will select from the levels and domains, and these are multi-select, so please feel free to select all that apply. And we'll just say something like that.
And Carl, I'm going to ask you to pause for a second in case people are doing this with you, okay?
Of course.
They won't be as fast as you. I'm not as fast as you. Okay,
Okay, and I'm gonna go ahead and just click submit. And it will create this new collection for me, empty. So there's no links and documents. There's no data items here at the moment. Now, as I mentioned, we will download the example data file. So for this, everybody can go up here to the collections page. By the way, when you click on this, you should now see the new collection that you just created, and that's going to be how you get back to the one that you just made. But I'm going to scroll this window all the way down to the bottom and click on this one here that just says ScHARe Think-a-Thon example data. And so that loads up here, expand out the data items section, and I'm going to click on these three dots and scroll down to the bottom of this menu and select download. And it popped down to my downloads folder. Now, while I'm here, I'd like to actually show a couple of other screens that at this point in the demo are best to show from this collection because this data file is already in here. So as I mentioned, there's the status icon. It's showing green with a little check mark. That means that all three of these are good: storage, parser, and validator. Again, I'll try to cover what those all mean, but for the moment, you can just say green is good. And then I'm also going to click on this. Well, actually, before I click on that, I'm just going to show. Well, no, we'll get back to that. That comes later in. I'm going to click on this item here, and you can see the contents of this tabular item, this tabular file. So there's a table here. I can scroll up and down, and I can also scroll left to right. There's a number of columns in this file. This file we prepared specifically because it contains a number of the ScHARe CDEs, not all of them, because we didn't want to kind of get overwhelming with potentially a large number of columns in our data. But you can see some pretty straightforward ones like age and race, ethnicity, gender, household income, etc. And then you can note that when I click on one of these information boxes, I get this pop-up that gives me some explanation about what that CDE is relevant to. I can see some of that information in a more kind of listing view by clicking on the dictionary tab, so I can see all of that same stuff right here. And then, is there anything else that I think I wanted to cover here? That's primarily what I wanted to cover. Yeah, we are familiar with that.
so Carl,
yeah.
why don't you go over this again so that people that were doing it, they can just see what you did. And because there two things happen.
Mhm.
One, they're doing it with you, and then they miss parts of what you're saying, and then some never got there. So if you could just, because this is a very important part of this initial piece, so just kind of highlight it again, okay?
Yeah. I'm going to go right back to the very beginning. So please forgive me if this is getting a little bit repetitive, but to create a new collection, you click on the collections screen at the top, and then click on create new collection in the upper right. You will fill out all of this material, including a readable name and an abstract, the tags and the CDEs. And once you've done that, you'll be able to click this submit button at the bottom. I won't repeat that process here because I've just done so. When you complete that, filling that form out, you'll be taken to your collection's main page. This is your private collection that you just created, and you can upload any data you want to that. You can provide links and documents by clicking on Add New here. And you can also upload data into this data items. Before we upload something, I'd recommend that everybody downloads the sample data file. To find that sample data file, we're going to go back to the collections list and scroll this window all the way to the bottom, where you'll see Share Think-a-Thon example data. You can click on that and then expand out the data items section to see that example data item. And then to download it, all you have to do is click on the 3 dots, scroll down to the bottom of this menu and select download. And it will download that CSV file to your computer. If you'd like to see more information about what's in this example file, all you have to do is click on the name of the file. It will load up what that file looks like. You can scroll this window left and right, up and down, and look at the contents of that data. And you can click on these little info pop-ups to see more information about the CDEs that are assigned to this file. All right. So what I'd like to be able to do now is to actually show you what it looks like to upload that file. So once again, I'm going to click up here at collections and click on this tutorial. By the way, a faster way to get there is you can also look in your recent menu and find that collection name that you just created. I have a few more than you do, but you'll find yours very quickly. Then I'm going to click on data items. I'm just going to click here. I could drag and drop, but clicking is slightly faster. I'm going to select that example file, and it'll show up in the files that are ready to upload, and then all I have to do is click Upload Files. So if you're following along with me, you'll get to this screen here. And actually, I want to pause right at this moment, because it's at this moment that we need to start talking about how the repository handles CDEs. And to best explain that, I'd like to go back to the slides, and we can talk through CDE mapping and CDE assignment on the repository. Okay.
Before you start, Carl.
Yeah.
I'm just going to address human nature. So for those of you guys that are human and you're curious and you're on the web page and you're kind of playing around, I'm going to ask you to pause and go back and now listen to Carl, because this is sort of the next instructional steps. And I don't want you to miss it because you were busy playing around on the system trying to figure it out on your own. I know human nature. So I'm going to encourage you to now stop and listen to Carl. Thank you.
Thank you. Okay, so let's talk about CDEs. You've heard a lot about CDEs and why they're important. And you'll hear a little bit more about that now. But as a matter of fact, what I want to talk to you most about right this moment is why the repository is designed the way it is in terms of how it handles CDEs. So you may be familiar with other approaches to CDEs or other repositories that work with data that's under controls, and you might be expecting that the repository will require that you conform your data to the CDEs before you upload it. We've taken a different approach. So our repository does not enforce the use of CDEs. You can upload anything you want. You can cancel out of everything when CDEs come up, but you'll see it come up frequently, and we strongly encourage, and as a matter of fact, may even require in certain cases, that you use the CDE functionality before that data is made public. In particular, the reason why we've designed it this way is that we want the repository to give you as many options as possible in terms of using the tools that it offers to help you through the process of getting your data to align with the CDEs. And as such, there's two main approaches or two main tools that we're going to look at. One is the assignment at the time that you upload your data. This is a relatively straightforward sequence of dialogues that will appear that'll guide you through a semi-automated alignment of CDEs to the data that you've just uploaded. Many people following that point will have other issues that they will need to address, things that didn't map cleanly, things that didn't assign cleanly onto CDEs. And so for those cases, the repository offers an approach called data views. And we'll go into a lot more detail about how data views work and how you can use data views to map your data to CDEs. So the first process that I said about assigning your CDEs at upload time, you may have seen that one dialog appear just at the moment that I
Carl?
uploaded. Yeah.
Excuse me. Let me just clarify something. What Carl just said, and he used the word mapping intentionally, because there's two things that happen with CDEs, common data elements, those of you who have used them. If you're in a project and you're required to use that CDE, of course, it's going to be a perfect match because everyone started using the same CDE. That is the ideal world. That is the world that I hope that I live long enough to see, or work long enough to see. But that's not what we're dealing with today, because everyone doesn't use CDEs, but everybody collects the same kind of information oftentimes, especially demographic. So you might collect age, you collect race and ethnicity, and race and ethnicity collection is actually changing because there was never a MENA category, and or Hispanic used to be another question for ethnicity, and now it's a racial category. So what he's talking about right now is, in the imperfect world that we live in collecting this data, you can map, because we actually collect similar information, even if it's done in a different way. So what he's going to cover right now is the mapping of that common data element to the ScHARe CDEs, because some things are mappable even if they're not a perfect match. So this is what he's covering now, and this is why I want you all to, rather than playing with the website. Okay, Carl.
Of course, thanks. So a dialog will appear and it'll just give you a little bit of background information. ScHARe CDE about data elements. Anyways, you'll click OK to continue on the process. If you click cancel, that's just indicating to the system that you're not ready to work with CDEs at that particular moment. And you can revisit that process by using a different tool, which we're not going to demonstrate today, but is also available, called Configure CDEs tool. It'll allow you to do fundamentally the same thing that you see in this dialog series. Once you've clicked OK on that first dialog, a second one will appear. Basically, just accept the defaults. That is the point where we're hoping in the future to have more selection options about the information that you may give to the system about attempting to automatically match your CDEs to those to that data file that you've uploaded. Right now, we just have basically one algorithm to do that matching process by looking at the column headers that your file contains. If in the future we're able to develop more advanced algorithms for that, this will be the point where that shows up. Once you've passed through those first two dialogues quickly, you'll get to this last one. It's large, you won't miss it. It gives you the chance to review the list of CDEs, the list of ScHARe CDEs, and then which column the system has inferred is most likely aligned to that CDE. So it's at this point that you'll need to pick up from where the computer left off, and you'll need to do two things. Number one is you'll need to double check that you see the expected, what you would expect is in terms of alignments between those CDEs and the data that you've uploaded. So sometimes the predictor is not able to make an assignment, and so it'll leave something blank. If you know that you collected that data or data related to that, and it's not showing up, then click on the drop down to select that one. Other times it'll make an incorrect alignment because it tried its best, but it didn't quite align that. And if you spot that as well, clear that out or adjust that alignment as is necessary. The second thing that you'll want to check is this final right-hand column that says data valid. So on the screenshot, you'll see that there's some green check marks. The green check mark means that when the CDE was assigned to that column, the data validation tool behind the scenes was able to confirm that your data conforms to the specifications spelled out in that CDE. So in this example screenshot, you'll see up there, it says age, and that age is green. That means that the data that was uploaded, it was able to find a column that was named age, and it was able to find numbers in that column that also conform to the age ranges that were expected by the CDE. You'll see in this example screenshot, however, that it's found a validation failure in the race ethnicity column. And when you hover over that red X, a box will pop down below that X, and it will give you some background information or some detailed information that comes from the validation system that tells you what mistakes that it found or what deviations it found. So in the case of this screenshot, if you can see the text, it may be small on certain screens. It's saying basically things like Alaska Native is not one of the expected exact values that are listed in the CDE. Now you might be saying to yourself, but wait, Alaska Native is one of the, the responses to the race ethnicity column. So why, or CDEs, why is this failing validation? And I also want to take a pause here to reiterate this eventual goal of seeing CDEs as a common reference point for solving what is otherwise a very challenging data cleansing operation and data alignment operation. So even if two groups ask exactly the same question on a given instrument, if they collect the data, but the data is not stored in exactly the same format, there's still going to be some need at some point in time, if those two groups want to collaborate, to do an alignment to some sort of common reference point. So it's the CDE, and particularly its definitions of things like permissible values in data columns that define what that common reference point is. And so even if Alaska Native, the word Alaska Native, represents the actual answer that somebody may have given to a question, if that isn't exactly what's specified in the CDE, then the validation will fail. Now, that doesn't mean that you're a bad person or that you have to go back to the beginning or any of that stuff. As a matter of fact, that's the mapping process that we will be covering very shortly. But just be aware that that's essentially why we flag that, is because we need to bring that to people's attention as something that they should address through their data preparation process. Because if you don't address it now, somebody will eventually have to address it in the future. Okay. And so that gives me kind of the segue into data views and how we can use them for mapping. So as I said, if your data doesn't conform to the CDEs, if you go through that first overarching process and you see, a certain number of validation failures, and you say, okay, I recognize that I need to adjust my data to get it to more accurately conform to the definitions spelled out in the CDEs, you do have two general options. You could go back and use your own tools. This may be a wonderful option for people that are versed in their own analytics or data preparation platform. If you've already got some scripts or tools or whatever that allow you to prepare that data, you may just use that first phase of validation to give you the information you need to go back to your own tools and adjust them, tweak them so that they produce exactly the output that's expected. And then you can upload them, annotate those CDEs as you would expect, and then you'll be good to go. But many of us are not really prepared to do that, either because we're not as familiar as we need to be with that kind of data preparation tool set, or the other case that can happen is you may not want to go back and modify your own data. Potentially you collected that data some time ago, and to go back and modify it would be actually kind of interfering with the lineage of that. And so in those kinds of cases, you can use the data view tool to bridge that gap between the data that as it was collected and the data structure that's expected when trying to assign CDEs. So what is a data view? This is a new concept. If you've never heard of it before, or if you feel like it might be kind of vaguely related to something you're familiar with, but you're not really sure, don't be surprised. We're going to be presenting it to you today and trying to demystify it as much as possible. A data view, from the perspective of our repository, is another item that you can place in your collection that is designed to take data from an upstream source, like a file that you've uploaded, understand it as tabular data, apply a sequence of transformation steps to that data, such as filtering or mapping, etc., and then producing a new table of data as its ultimate output. Data views actually have a wide range of potential uses. I'm not going to read them for interest of time, but you can see a few on this list. We are going to focus right now on how you use data views for this mapping goal. And the last thing I want to emphasize is that data views are designed to be non-destructive for your original data. So you upload your data, and then when you create a data view based on that, it'll produce a new table of results, but that original table is always present. And that also gives people the ability to choose whether the downstream data that may be mapped to the CDEs may be more relevant for their study, or whether it's more relevant for their study to go back to the original source. Potentially they've got questions that could be more accurately answered by that original data. So how do you use data views to map CDEs? It's a straightforward, roughly 3-step process. We're going to create a new data view item that is derived from that file that we upload. We're going to add in mapping steps to that sequence of transformation steps that perform the exact mapping operation that we desire. And then once we've prepared our data as we would expect, we'll make sure to tag in those new columns to the CDEs that we're expecting, that we're targeting. And we'll let the validation routine run again and confirm that we've accurately mapped that data. Okay, so bear with me as we go through this process. Again, we're going to go through it in slides, and we're going to flip over to the interactive demo, and we're going to see how this whole process works end to end. And once we get to that point, feel free to follow along with me, and again, ask any questions that might come up. So to create a data view, you start with that uploaded tabular item. So if you've uploaded that example CSV that I was talking about, and then you go ahead and go through that initial phase, you might at that point be ready to create that data view. So all you have to do is find the items menu, those 3 dots, or the item operations menu, click on that, and then locate the option that says create data view, and then you'll give it a name. So like I said, it's another item within your collection. And so you'll have to give it some sort of legible name, something that sets it apart from all the other data in your collection. And then once you've given it that name, it'll open up the Data View Explorer, where you are able to build up that data view out of the transformation steps. This is what the Data View Explorer screen looks like as kind of an overarching tour. The metaphor that we're trying to adopt here is that the source data starts at the top of the screen, and it flows vertically down through the steps, through the transformations, the mappings, whatever. And at the bottom of the screen, you see a preview of what the resulting data will look like once the data view is finished applying. Effectively, you will go ahead and add steps using the buttons that are provided in the center of the screen. And once you're done preparing your data view, you'll click on that Save Data View button that's over kind of in the center right of the screen. And that'll make sure that that's kind of locked in place. And the last thing to point out is that this is just the preview screen. So if you want to see the full results of that data view, you click on the Table tab that's up at the top, and that'll take you to the full output of your data view. After you begin kind of creating that initial data view, you'll want to add steps. And so the first step that we're going to add for the purposes of mapping is called Map Column. So you click on the Add Step menu and you select Map Column, and then you'll be presented with a window that gives you effectively what is your source and what's your target, and then what's the mapping that you want to define from that source to the target. So this is the part where I need to basically say, okay, if you've got, let's take that example before where the value was Alaska Native. The CDE is expecting the phrase American Indian or Alaska Native. So what you do is in that value map, you put Alaska Native, that's what your source is, where you're starting from. And then you type in that expected output value in the target value, and you click the little plus. And once you go through that process, you'll kind of repeat, you'll add in each of those values that you need to map. And then you can scroll down to the bottom of the screen, and in the preview, usually you have to scroll all the way to the right-hand side of that table view to see the new column that gets generated. You'll see that new mapped data, and you'll just give it a quick scan over to make sure that you've mapped the things as you expect. Again, I'll make sure to demo this clearly when we're interactive. Then lastly, once you've set up that mapping and it looks okay, you can go and add a data element to that column. And adding that data element is just a matter of clicking the button that's labeled Add Data Elements, selecting the column that you've just added, and then selecting the relevant CDE from a drop-down list. Once you've added that data element and you click Done, the validator will automatically run. And if you see 0 validation errors, you're all good. If you see any validation errors, you'll click on the status line and you'll be able to see what elements of the mapping you may need to correct, tweak in order to get the validation to pass successfully. And then all you have to do, if you have multiple of those columns that you need to do this for, you just go back and you add another mapping step, you fill in the mapping, and you assign the data element. You can put all of those things into the same data view. Lastly, before we jump into the interactive demo, I wanted to mention that we recognize that, well, this process may be tedious, especially for certain mappings that are standardized. So, for example, if you collected data according to certain pre-existing standards that may not perfectly already exactly align with the CDE, we've attempted to build some basically predefined mapping functions that will help you, that will kind of short circuit that process. Those functions are also relevant in the case where the mapping is not one-to-one. So in the example I just gave, it's a one-to-one translation from one source to some sort of output. But for example, if you collected income data, but your income bands do not match up one-to-one with the income bands that are defined in the ScHARe CDE, then you might have, it might not match well enough to use a simple mapping function like that. So if you would like assistance with using data views to map your data, please reach out to our support team. Because we would like to identify cases in which custom mapping functions are necessary. We may be able to put those functions together for you. And we'd also like to identify those cases where there's opportunities for simplifying people's lives by identifying standardized mappings. We've already tried to identify a few of those, so you may be able to find those by locating them within our step libraries. Okay, so at that point, like I said, I'm going to drop back into the interactive demo.
And just as he transitions into live, on the slides, and I'll have maybe Michelle put in the chat how to get in contact with them to do what Carl just said, to help you guys with mapping of CDEs if there are special unique issues.
Yeah.
And then we'll go back to Carl live.
Okay, so if you recall, if your memory is good enough that you remember where I last left off the interactive demo, it was right this point. What I'm going to do is click OK on this screen. If you are following along with me and you're not at this point, all I'm going to recommend that you do is, cancel out of whatever, delete the file that you have uploaded, and then re-upload that example data file. As a matter of fact, I'm just going to do that really quick just to make sure that that is crystal clear to everybody. I'm just going to delete this file by clicking on the 3 dots, scrolling down to the bottom and selecting delete. That's okay. And then I'm going to click here and just upload that example data file. Again, click on upload files. Okay. So hopefully we are, at least many of us are right back at this file upload complete dialog window. I'm going to run through this now, and then I'll actually take your advice, Deb, and I'll circle back and we'll do this one more time.
Yes.
I'm going to click OK here. And then this window appears for everybody concerned here. You can just click next. You don't need to worry about adjusting any of these settings. And then you're finally presented with this screen, which is that point where I suggested that you review the list of proposed mappings and confirm that everything is accurate. Now, I will admit as a little bit of demo magic for all concerned that we've tried as best as we can to limit the amount of unexpected behavior that the site might give you with your own data. So you'll see here that most of these columns map as expected. We prepared this data in advance so that we would have fewer glitches to have to explain to the audience. But there are a couple of things that I did want to call out and also kind of show some examples. So one is that you'll see, for example, this birthplace US is not assigned. I can click on here. If I had a birthplace column, I could assign that here. For the purposes of this, I'm just not going to assign that because we didn't have any birthplace data. You can see here that we've got 2 red X's. So let me explain what those each mean. So this one, it says race ethnicity, and you can see that red X. If I hover over that, you'll see what it says is no is not one of American Indian or Alaska Native, blah, blah, blah. Okay, and then it says yes, no, yes, no. These are my values, the values that are in my data set. And you can see here that these are the values that it's expecting. So what's going on here? So by the way, I wanted to briefly mention that it's highly recommended when you go through the CDE assignment process that you are already familiar with your data before you upload it. Now, I'm going to assume that that's the case because usually people are uploading their own data, but you guys are all at a disadvantage in this because you haven't really looked at this data too much. I handed it to you, so I'm going to have to explain to you a little bit about what's in it and what you may or may not be seeing as you go through this process. So it turns out that the race ethnicity data that's present in here is actually multi-select data, which means that rather than having a single column that gives a race category, there's one column for each checkbox in the original questionnaire, and the values yes or no are present whether somebody checked that box or not. And so if you look at the data that we have listed, we actually have 7 race ethnicity columns, which corresponds to the 7 race ethnicity categories in the CDE. So in order to get the system to recognize that we have this multi-select option, we actually have to take the CDE and tell the system we're treating it as a multi-select CDE. To do that, you go all the way over here to the left. There's a little icon that when you click on it, it changes from single select into multi-select mode. And then from here, you have to assign each individual columns as you would expect. Now, this is a point where you would want to go back to your own data dictionary and make sure that you've got number 1 corresponding to American Indian, etc. This actually turns out to be demo data, so it really doesn't matter, but also this is what was intended, just to select them all 1 to 7 going down. So now you'll see that after I've assigned these checkboxes, now I'm getting that validation to pass. Okay, so that's number 1 cleared away. Now let's look at the second one. So gender is a single select. So that's not the problem that we have to deal with here. But when we hover over this, it says, okay, none of these describe me is not one of man, woman, non-binary. Trans is not one of man, woman, non-binary. Male is not one of man, woman, non-binary. So this is an example where the data should conform to the CDE, but it's the textual values present in the data column that are misaligned. So rather than the words man and woman, we have male and female. Rather than the word transgender, we have the word trans. Rather than the word non-binary with a hyphen in the middle, we have the word non-binary with no hyphen. So this is a case where that mapping tool is going to come in handy for us, because we're going to be able to define the mapping from male to man, female to woman, et cetera, et cetera. Now this could also come up if your data collection system doesn't use words in its output, but uses something like codes, right? So your system may code, 1 to man and 2 to woman and 3 to non-binary, et cetera, et cetera. And again, that's a case where the system isn't going to automatically be able to determine what the number 1 represents. You'll have to put that in, and you'll have to do so by the way of using that data view to map your data to the CDE's expected output. So at this stage, since we're having a validation failure, we can actually do 2 things. One thing is we could just proceed as expected. And that actually tells a downstream user a little bit, right? It says that this is a gender column, the gender CDE is assigned. But because the validation is failing, you're not going to pass your analysis readiness metric, and you're going to get a red X in the validation column when people go look at that data. So actually, I recommend that you take the second path, which is for this point to simply clear that out, clear that CDE assignment out by clicking on the dropdown and going all the way to the top of the list where there's a blank. By blanking that out, you're just simply telling the system, don't look at the gender CDE for now, and you'll make a mental note to make sure that you address that with the data view in the next step. Okay, so we can just see that we've got green check marks for the rest of this. And the last thing that I need to do here is just click assign. The system is going to go now and do some processing on that data. It's actually running that final validation routine on the entire set of data in order to try to catch any other places where that validation might fail. Now that that validation routine is done, you'll see that we get this nice triple check mark here, and our analysis readiness metric has updated, and our CDE compliance has also updated as well. Okay, so what I'd like to ask is maybe a little bit of patience as I'm going to go back to the beginning of this upload process and just talk through it once more
Thank
for
you.
anybody who may have gotten lost in that first pass around. Again, to kind of by way of explanation, we're just going to delete this file so that we start this process all the way from the beginning. Okay. Click on this to upload a file. Select the file from your computer and click upload, then click on upload files. It'll process for a moment and show you this dialog where you will get the chance to proceed through the CDE process. You can cancel out and go use the Configure CDEs tool if that's more appropriate for your time. I'm going to click OK, and then we're just going to click next through the second dialog since there's no other matching methods we want to try to use this time. The system is going to attempt to align your data to the CDEs through a search-based process, and it's going to present you with a screen where your task is to confirm the CDE assignments as you would expect based on your understanding of your data. So for example, if you see that birthplace is unassigned, but you knew that you had birthplace data, or if the inverse, if you see that birthplace was assigned to something, but you know that you didn't ask that question, you want to double check that because the system can get it wrong in either case. You can also double check that validation is passing, particularly for those columns that you expect it to pass. In this example data set, we have two columns that don't pass validation. The first one doesn't pass validation because the system has not recognized it as a multi-select option, and that's something that we need to manually set up. And the second column doesn't pass validation because our data values are incorrect. We'll look at that second column in just a second, but first we'll talk about how to get that multi-select option to be set up properly. In order to set up a multi-select CDE, you click on this icon in the left, which changes that CDE from a single select to a multi-select. And then you have to select which column represents an individual value from that CDE. So in the case of race ethnicity, we have 7 checkboxes that are numbered 1 to 7. And if I can double check with my data dictionary to make sure that I get the numbers aligned and I don't cross my wires, I can click through these one at a time and then assign all 7 of my race ethnicity columns to that race ethnicity CDE. Then for the second CDE, we notice that there's a validation failure, even though the column is assigned as we would expect. And when we hover over that validation failure message, we see that the values that are present in our data do not reflect the exact values that are present in the CDE definition. And we can see what those values are just in this list: man, woman, non-binary, transgender. Those are what the system is expecting. But the phrases that we see are things like, none of these describe me, trans, male, female, rather than man, woman. So in order to correct this second problem, we're going to do 2 quick things. One is we're going to clear this assignment out and take a mental note so that we can do the second thing, which is to use a data view to perform this mapping. Okay. I did a quick second tour around that little bit. If you have any questions about that process, or if any other questions come up as we go through the data view stuff, please post them in the chat. I'll try to keep an eye on that. What I'm going to do now is click assign, and that'll tee me up to set me up to go to the second part, which is the data view part. So now that I've got that data item all set, I'm going to create a data view from this. I can do that right here just by clicking on the 3 dots and then selecting Create Data View. It's about in the middle of the menu. And I'll just give it a quick name. So mapped data. Say Create Data View. So now this new screen appears, which is the Data View Explorer. This is the place where you can go ahead and set up your data view. By default, the data view comes with just a single step, which doesn't do anything other than limits the amount of data flowing through the data view. It gives you a little bit of chance to kind of work with the data without having to have it process your entire file every single time. And then out at the bottom here, you can see a preview of the results. Because we haven't really changed the data, this is effectively what our data looks like right now. So once again, you can see these CDEs that we've successfully identified are all here. We're missing that CDE assignment for gender. That's the one we're going to try to fix. But you can see a few other CDEs here. And then, you know, just for good measure, slightly pun intended, these are the other data that I collected as part of my study, which was not a real study. These are just random numbers. Okay, so the mapping process is very straightforward. We're going to click on this button that's labeled Add Step, and then we're going to select Map Column from this list. Feel free, if you're running ahead of the class, try out some of the other steps and see how they go. The map step fundamentally asks for 3 pieces of information. What data do you want to map? So in this case, that's the gender column. I could also just type in gender and it'll quickly bring me to that. It'll ask for what the output wants to be. And actually, I want to change this to gender mapped just so that what I'm doing is creating a new column of data, and that'll help you kind of see the difference between the two things. Sometimes you want to preserve the original data, or sometimes you just want to replace the mapped data to simplify things for downstream users, and that toggle will let you choose between those two options. And then the last thing that I need to do is put in the map values. So I remember that one of the things we needed to do is go from male to man. So once I click this, the system will update. And if I scroll to the right here, you'll see that it mapped that value of male onto the word man. And it hasn't mapped anything else yet because we haven't put in any of the other values. So let's quickly go ahead now and we'll look at our list here and try to see some of the other things. So there was female to woman. There was trans to transgender. There was non-binary to non-binary.
And by the way, what Carl is going through right now is new also, just like ONB is coming out with the new categories for race and ethnicity. There's discussion on how best to collect this kind of information. And this is the current NASM suggestion of how to collect this information. So this is an important part of mapping because we've never had to collect this information before. And it provides us with, by being able to map to it, we can kind of link our old data to the new way. Exactly.
There's one other quick thing that I wanted to mention with the mapping, which is that if, for example, you have a value that's the same on both sides, you'll see right now that the mapping by default, if you don't provide a value on the left, then the target value will just be null in this case. So you can see that prefer not to answer. I haven't put in a value for that. But because that is the same on both sides, I can simply say, put the source value in whenever you don't find it in the map. So that completes that mapping here. And so our data has been mapped. But the last thing that we cannot forget to do is make sure that we put the CDE assignment on that new column. Because without putting the assignment on, people are not going to be able to identify that data as specifically relevant to that CDE. So to do that, we're just going to do one last step here. We're going to click on Add Data Elements. And here you see all of the current data elements that are assigned. And actually, most of these data elements are assigned from the source data, right? So that process we did originally. We're not going to change or try to override any of these assignments. But we are going to do is add a new assignment for this gender mapped column that I just added. And then all I have to say is pick the right data element from that list and then click Add and then click Done. All right. So at this point, we're almost done, but you'll notice there are some validation errors. Not that much of a surprise. I did this from memory. I probably messed something up. So let's find out what we messed up. And I'll do that by just clicking on this. And it says, none of these describe me. I would like to see other options is not one of blah, 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 blah. Oh, okay. So I said, I would like to see other options, but it actually wants me to say, I would like to consider additional options. So I can fix that by just going onto here, finding that value that I typed in, consider additional options. Okay. And did I get it right? None of these describe me. I would like to consider additional options. There's a quicker way to do this. Just delete that and we'll cut and paste. Oops. Now I'm a little bit flustered. We did change this file just before the training and I wasn't sure about this. Is this that case that I've... Yeah. Okay. I do actually remember running into this. And this is something that I need to talk to the ScHARe team about because it's a little bit actually beyond the scope of the system. But for the purposes of this, let's just understand that here, actually, there's another way that we can kind of move on from this. What I'm going to do is delete that option. So it won't map properly, but I can say null here. And all that does is basically say, okay, for cases where that data is not mapping as you would expect, when you map that value to a null, it's effectively telling the system that you either didn't ask that question or you didn't ask that in a way that maps cleanly onto the target CDE. So because we're unable to map that one option by specifying it as null, we're essentially just saying that will have to be that data will have to be dropped. Sometimes you have to make that judgment call, especially when when you have asked questions that don't directly align to the CDE. Okay. So at this point, this completes our setup of the data view. The last thing that we want to do before we move on is to remember to click the Save Data View button. It will give you some warnings if you try to click away from the screen without saving it. And then if we go up here and we click on the table, give it a second to process the data, it'll show us the results. Now, there's one other thing that I skipped over really quickly, which is that you actually see only 10 results here. And that's because we actually didn't remove that one step that I said comes kind of by default when you set up a data view, which is just to limit your data to the first 10 rows. This isn't actually what we intend, right? We want to be able to show people the full process data. So all we have to do, if we've made that simple misstep, all we have to do is go back to the Data View Explorer, click on that tab up at the top, and then just delete this step that says take limit rows. We'll just delete that and we'll save it once again. We have additional errors. Oh, there we go. Fixed another error while we were at it. Save that data view. And then look at that table. And here's our final results. So once again, we have that original gender column. It's not mapped to the CDE because it doesn't align to the CDE. But if we scroll all the way over, we will see that gender mapped column, which does align to the CDE as expected. And you can see that that CDE is assigned with that little information icon. Okay. Do we recommend that we go over any parts of that again? I know that we're actually running close to the end of our time slot. And so we have other material that we may want to cover.
Yeah, I think we can go to the other material. We will have time frames that bio team, so Carl's group, can help people. And of course, you can email the ScHARe platform. Luca or one of you, please put the email to our ScHARe in the chat. That email is monitored, so we can help you when you reach out. But don't get frustrated if you run into bugs, because what you just saw is the developer ran into bugs. So just contact us and we'll fix the bugs. Okay?
Absolutely.
So go on to the rest of it, because
Yeah.
at least we'll cover it.
I'm gonna share my screen. There we go. Okay, so if you've been following along, which I hope you have, give yourself some congratulations because we have managed to create a place to hold your data in the form of a private collection. You've learned how to upload data dictionaries, documentations, anything that are related to your data into that collection. You've learned how to upload tabular data and view it within the site. And you've also learned how to use the CDE-centric tools to both assign CDEs as well as map your data to CDEs. As always, if there's questions, please post them in the chat or save them for the Q&A session, a time that hopefully we'll have a little bit at the end. In the interests of our time, I am going to kind of move through the remaining sections. Again, please slow me down if there's anything that needs a little bit more clarification. We've gone over this screen that allows you to see kind of what's in your collection. But I did want to go back and make sure that we cover these metrics that show up in the right-hand sidebar when you're viewing your collection. So there's one that's called analysis readiness. And this is a very simple metric that basically communicates to people who are viewing your data about how ready that is for them to perform analysis on this data. This is a very simplistic metric at the moment. We may improve it as time goes on, but right now it focuses on 4 key aspects. Did you assign the metadata that you would expect to your collection? So in other words, have you applied those tags? Have you applied those project level CDEs? Have you assigned CDEs to your data, either partially or fully? Obviously, not everybody has collected every single CDE, but if you've gone through at least some of that CDE assignment process, that'll pass you on that regard. Is the data accessible this is often a system level thing. You might think about if you've uploaded a file, it's the system's responsibility to keep track of that and not lose it. But if you've linked to data that's outside of your collection, that could end up being a broken link, and that might be something that you as a user might have to identify and correct. And then the last thing is, does the data pass validation? So we've seen examples about how that validation routine works, how particular it can be in certain circumstances. And so if there's anything that you need to address with regards to validation, that will also show up in your analysis readiness metric. Secondarily, there's a CDE compliance metric, which just simply shows how many of the ScHARe CDEs you have assigned to your data. And this gives people a very quick scan view on how much they may expect to be able to find relative to your own data. So obviously, if you've collected a lot of CDE-related data versus maybe just a small amount of CDE-related data, you can click on either of these metrics to expand them and see more details. And so in the CDE compliance, when you click on that, you'll see the specific list of CDEs that are present in that data. Now let's quickly talk about sharing data. The repository is designed around this concept of access levels. So each collection has an access level assigned to it, and that defines the maximum amount of permissions that can be applied to that collection in order to share it with other people. This gives you a very quick at-a-glance view on whether or not other people and how many other people could potentially access the data that you place in your collection. So by default, all collections start out at the private access level, which is basically a place where only you as the collection owner can access the data and can even see that that collection exists. If you would like to upgrade that access level, you can do so by clicking the buttons at various points. So on this screen, for example, if you click Make Confidential, what you're indicating is that you'd like to upgrade that access level to confidential, which allows you to share it with users that you specifically name. And so then you get a chance to identify users and then select what their role would be, whether they're a reader or a writer, or they can administrate the collection. We plan in the near future to implement controlled access. So for data that requires passing through a review committee in order to be able to grant people access to that, that would be handled by the controlled access level, which is coming soon. And then lastly, the public access level, which allows any user visiting the site, whether or not they're logged in, to be able to access that data. With public access data, you can also share that with specific named users if you want to continue to have collaborators to be able to manipulate the data present in that collection. For public access data, recognizing that not all data is instantly fit for public consumption, the ScHARe team is putting together a process that will communicate clearly soon. But effectively, the core elements of that process are that you'll prepare your data in your private collection or in your confidential collection. And once you get to the point where you believe it's ready for public consumption, you'll contact the ScHARe team. They will instruct you to give the public review group access to administer your collection. And that's necessary so that they can view the contents of your collection, review your data for compliance with the guidelines, and then be able to update that access level to make it public. So you are not permitted to make data public on your own, but once the review team has confirmed that that data is ready to be made public, they will do so. And they will actually do so by way of creating a static version of your collection that won't be modifiable by anybody. That also gives you the ability to go back later and add additional data without that additional data being made public until that goes through another round of review.
I just want to add, this is a necessary step because we have to make sure that no PII gets out, no personal identifiable information. So this is one of our, I guess, checks to make sure that there's no mistakes accidentally done, the wrong button accidentally. But this is a measure to protect PII.
Yeah, and in the future, we will have more tools to identify PII and to make the review process smoother and potentially more automated. The last topic that, if we have time to cover, is to talk about the ability of the platform to facilitate data aggregation and analysis. So obviously, the repository on its own is great for making data visible to people, but most of the time, if you're finding data on the repository, you're actually looking to do downstream analysis of that, whether you're looking for collaborators' data or even your own data that you may be storing there for organizational purposes. So we encourage you to look in the future for a Think-a-Thon where we will give you more details on how to link your data to Terra specifically, and how to use the features of the repository to build aggregated data sets. But for now, we'll just give a very quick overview about what's available. You can effectively link your data.
Carl,
Yeah.
just a second. When Carl means connect to the Terra platform, what that translate in plain language means is that we bring the data into the Terra platform or connect to the Terra platform in order to do the analytics. So when you want to analyze your data, that's when you go back into the ScHARe piece. So we bring the data into Terra to analyze it.
That's right. Right. So you can access data from the repository from a Terra Jupyter notebook. You, of course, can download the data to your own computer and use your own analysis tools, or you can use the features offered by data views to perform a certain subset of analysis tasks. So in the context of Terra, we have built basically a client for the repository that allows you to connect a Jupyter Notebook working session to the repository using your own credentials. So you access your own private data through that connection, as well as any public data through that connection. And then through that connection, you can also retrieve tabular data in data frame format, as well as you can access the raw data as well if you need that. And so that access of data in the data frame format provides a very quick shortcut in order to do any sorts of visualizations or advanced statistical techniques in the Terra context. We are looking also in the future to add similar functionality to other statistical packages. So please give us feedback if you like this approach on Jupyter, but you would like to see it in other tools like R or SAS or whatever. And we will have example notebooks that demonstrate how this works in the very near future. As I mentioned, you can download the data. So you saw an example of that earlier where you just click on those three dots and you select download. But I wanted to highlight there's another menu option here, which is equally as powerful, which is the export table data option. So if you want to work with the raw data, as it comes straight off of the repository, you can use that download link. But if you would like to work with a format of that data that may be translated into something that's easier for you to work with, or if you'd like to work with data that's been mapped using a data view, you should use the export table data option. You'll get a quick selection about which format you want to export that into. CSV, TSV, and Parquet are currently the ones that are supported. And this will, for example, allow you to do basic stuff like data translation. Like if you've got a collaborator that's working with data in SAS format, but you are, working with Excel or Jupyter or something like that, and you can download that SAS formatted data in, say, a CSV format using the export table data option. And then lastly, we can go back to our data views tool. Again, this is kind of like the overview about what data views are all about. But in this context, I want to give a brief skim through about how you would use data views to join data sets together using those CDEs. Before I actually show that, I just need to take a very brief detour to that kind of the browsing and searching experience. Again, if you've been clicking around the site, you may have kind of already familiarized yourself with this, but you can see data from the collections tab. You can also put in a brief search query with that search bar at the top, and then navigate your way over to collections or items that contain that data. And we are actively working on improving this experience, so look forward to that. Once you've found data that you would like to aggregate to your own data, there's one other step that's important to emphasize. So data views are designed to work with data that's present within the collection that they reside in. So in other words, if you've uploaded data and then you create a data view, you can access that data within the same collection. But if you want to access data in a data view that resides in another collection, all you have to do is link the data from that source into your current working collection. And that's a very simple process. When you find a data item that you would like to access within your own collection, you click on the 3 dots menu and you select the link to option. And it'll present a dialog where you select the target collection that you want to send that link to. And when you do that, and then you go and visit that target collection, see that there's a new item that appears that is, it basically looks like you've copied that data into your collection, except no copying was done. Just behind the scenes, there's a link, and you can reference that data as though it was an item that was in your collection. Once you've done that, you can create a data view based on your own data, and then add in a join step from the add step menu that allows you to select that secondary table to join your data to. So all you have to do is select from the dropdowns, you'll select the second data table, which is that item that you just linked in, and then you'll select which columns you want to align. When you're joining data in this method, what you're doing is saying, for an entry that contains this particular value in this column, go and find that in the other data table, and then tack on all the data that's associated with that into my new table. So in the example screenshot, I understand the text may be small, I apologize. But what we're doing is we're joining sample data to a public data set, which is coded by zip code. And since we can find a one-to-one match between the zip code data in the public set and the zip code data in our sample set, what we can do is bring in all of that other data from that public data set that correlates to that zip code and bring that into this aggregated output of this data view. The only other thing that this data view contains is a column selection box, because when you take all of your own data and all of that other project data or public data and you jam them together, you end up with a large number of columns. So you can use the column selection box to trim that down to be a little bit more focused on your own, on the questions that you're interested in. And if you can see at the bottom of the screen, you'll see some of that data that was collected for that project aligned with public data that is also correlated with that zip code. So we've reached the end. Once again, thank you all for sticking with us. In summary, we've covered all these topics about creating collections, uploading data, mapping to CDEs, viewing CDE compliance, and then topics around data sharing and data joining and data analysis. And
So,
one last thing here for links.
So we'll leave that up for right now. I'm going to open up the forum to see if there's any questions. If you have a question, please turn on your camera. And we'll answer the best we can. So we might go a little bit over. At the same time that we're answering questions, I'm going to ask Kevin to put the evaluation for Slido up. And what we ask you to do is to do an evaluation for this webinar. And we ask you to do that because we actually pay attention to them and try to change whatever feedback we get from your evaluations. So please do so. Kevin, do you want to explain it real quick?
Absolutely. So my colleague Elizabeth will put in the chat the link to access the Slido. It's the same link as you used before. Alternatively, you can use the QR code that's shown here, or go to slido.com and use the code SHARE. Back to you, Dr. Duran.
So he will leave that up, and what we'd like to do is open it up. If you have any questions, any comments, anything that you want to say right now, please ask, comment. Uh-oh. That means either we wowed you or we lost you. I'm not sure which, and maybe we have both sides. So I'll just add a comment that one of the things that the reason we're doing this is that we know that you have to comply with the NIH data management and sharing policy. And hopefully this is a tool that will help you, people who are doing health disparities research, population science, social science research, to have a home. Because a lot of the repositories don't focus on these types of topics. So I hope we create this home for you. This is our first initial release, but of course, as Carl even said, we want your feedback on it, because what my goal is in this is to make the easiest repository ever created, so that it's more click and drag, easy to follow along, but the most effective, meaning that it has a data aggregation tool. We use common data elements so that people can easily see other data sets that, remember those little circles Carl presented? It tells you how many common data elements you have in common with someone. And we're really working at finding the best organizational structure, which is coming up as well, because the other thing that we know is that the organization of most of these are non-existent. And so we want to create a good tool. Any comments, questions, insights, recommendations that you can see right off the bat?
Suggestions for improvement or additional functionalities?
Well, I guess we wowed you. I'm going with that. Can you put up the help screen again now, Carl? Because I want to leave this with making sure that people know where to go for help.
Yep. And I also see Elizabeth posted a quick question, which I think is very appropriate. She asked, what's the advantage to linking data versus adding it to my collection. So when you put anything into your collection, that's something that you own and you can control. When you link data from another source, what you're representing is that other source controls the data, but you still want it, you still need it as part of some of your studies, or even you may just want to include it alongside of your own data. You may be just saying like, this is relevant data, but you're not taking responsibility for it. You don't have to keep it up to date. The target of that link is responsible for keeping it up to date. There's also
another reason.
Yeah, you're saving space. I don't know if you're going to say that.
Yeah, no, there's another reason, because when you link the two data sets together, let's say your data set had 100 racial ethnic population group, and another data set had 200 racial ethnic population group, and you link them together, you now have 300 racial ethnic population groups. And they're linked so that you can create the data sets, and you saw the data aggregation tool, so that you can select the columns that you actually want to analyze. So linking data also increases the volume and the amount of data you have. And this is the mindset when, remember at the very beginning, I talked about a paradigm shift in health disparities research. Because what we're trying to push here is to get bigger data sets so that you have a better understanding of a health disparity that you couldn't just get from a small study.
All right, thanks for that question.
And just to make clear, again, all of this information will be posted. It takes us a couple of weeks to make it 508 compliant, because if you post it on the internet, it has to be publicly accessible to everyone. So it just takes us a little bit of time. But it will be there, the slides and the video. Okay. Well, if there's nothing else, then we'll sign off, and we really thank you for attending. And the next Think-a-Thon will also go over the repository, and we'll try to take information that you gave us from this one to make the next one better, and maybe introduce even some features that got added in the next month. Okay. Thank you all for coming, and thank you for filling out the different forms.